by saying, welcome. I'm here with Professor Danny Blanchflower, who's Professor of Economics at Dartmouth University in the United States.
College.
Dartmouth College. Originally you're Irish, right, originally?
Born in Brighton.
Born in Brighton, okay, originally.
The Irishman is a soccer player. Just to go back to Dartmouth College, it turns out there's an absolutely famous Supreme Court case called where the state of New Hampshire took over Dartmouth and called it a university and said it had to be public. And it's the most famous case, which allows universities to be private. But so we're called Dartmouth College, but because the word college is not such a great name, we actually call ourselves Dartmouth now.
Right. Okay.
Names
I didn't realize it was called Dartmouth. Anyway, Danny is one of the leading labor economists in the world, I'd say, but somebody who's looked at both the UK and the US labor markets in great detail for at least the last 20 years, or am I underselling you?
Oh, good. A lot, even longer, really since the mid-70s. So it's been...
but also has done work on the economics of happiness and well-being, which of course has been a very fashionable field for the last 10 years. But again, Danny was doing that rather before it became fashionable. So you've been doing that for about 20 years, haven't you, with Andrew?
I think a good way to start this debate out actually is if you in the UK, it's really hard to see exactly what's going on in data. And we're going to talk a lot about what's happened in the labor market data. The one thing I think that should set us off is actually the thing that we've seen more than anything is the biggest collapse in happiness and well-being that we have ever seen. In a period of a couple of weeks, the average happiness level in the United Kingdom on a scale of 1 to 10 averaged about 7.2. In the space of 2 weeks, it dropped to 5. It's adapted since then. But this sort of reflects the order of the shock that we've seen. I mean, a shock of, enormous magnitude, a 20% drop in GDP in a quarter. Just to put it in context, it took 5 quarters in the Great Recession to go down 5%. So the first thing is that we have never seen a shock like this. We don't really know quite how to measure it. And I think the UK is in a very weak position to actually work out what's going on because of the poor quality, particularly of its labor market data. I've said endlessly over the last 25 years that the UK data is the worst in the advanced world, comparable to Greece, but lags behind other countries. In the United States, we got data today for September. The UK is miles behind that. We get the raw data. And in a sense, the starting point for any discussion should be that in the UK, we've basically not seen any movement in the unemployment rate. I mean, it was 3.9 for 4 months in a row. Yeah. And the last one, we got to 4.1. Well, let's suspect that that's probably not a really good indicator of what's gone on. And we have data for the US, which is very, very difficult to comprehend in lots of ways, not least because we've got weirdness in wages, and we'll talk about that. But the US saw, in the period when the UK had no rise in unemployment rates, the US saw the unemployment rate go from 3.5 to 20 in the space of about 6 weeks. And we got new numbers out today with a number around 8%, 7.9 or so, with every expectation that that's going to go and get bigger. And in the UK, my suspicion is we're going to see a very big rise in unemployment. So the issue in part, John's been good on this too, which is, okay, what does the data say? So it's like, yeah, the data on unemployment has been fine, but actually unemployment hasn't been fine. And so we need to talk about how we work out what's going on in the greatest shock that we've ever seen. And obviously the UK government's propped things up. And the US government did that too, but we're experiencing in the US the effects of removing that stimulus. So lots to talk about, but I think we're going to see something pretty bad coming in the UK, not least because of the foolish decision on the part of the Chancellor this week to give firms enormous incentives to just fire people.
Okay, so shall we start with the UK? So in the UK, as you say, one of the really interesting things about this crisis is, and of course it is, I agree with Danny in part about the data, but this isn't just about the timeliness of the data in the UK.
Yeah.
It is a fact that what happened has mostly happened in the UK to date, as that people who've had to stop, whose jobs are either temporarily or permanently have been removed by this crisis, have mostly been put on the government's furlough scheme, the coronavirus job retention scheme, which means that they are still notionally employed and still mostly being paid, and hence not yet looking for work.
Absolutely.
What happens if we come out of that?
Well, I think the big question, I mean, there's a measurement question, and you're right. It doesn't come in the unemployment numbers because they're not available and willing to work and actively seeking work. So they don't get into those job numbers. Firms have temporarily, supposedly, furloughed people. And you know, when times get good, they're going to go back to apparently to full-time jobs. But I think the Chancellor's statement this week completely misunderstands what's going on. I mean, the question is, are those firms that furloughed people subject to the scheme, are they just going to say, oh yeah, life's just fine, we're going to go back to normal as the economy slows again? And I think a great example is me. I mean, I'm teaching my class at Dartmouth. I'm in Florida. I haven't been to my office for a year. I mean, I've stopped all kinds of stuff. I mean, I don't go to my office. And particularly, are people going to change their behavior? If they're working remotely, that's going to have a major impact on all kinds of things. So the Chancellor doesn't seem to understand that if there's a long-run behavior change, I'll give you an example. In Hanover, New Hampshire, one of the big stores was a gelato store. It's like ice cream, right? And so the crisis comes along. The owner of the gelato store actually writes very quickly and says, I've been offered all kinds of assistance to help this store come, and I can't take it. My store is done. My model consisted of basically from April through October, people showing up in the evening, sitting outside my store, eating gelato and sharing and shooting the breeze. She said, there's no point in me taking financial aid. My business is done.
So, but I guess let me take the position of the Chancellor, or at least in part, for a minute, and say, okay, I accept that. This is going to lead to a long-term set of changes, and because and that's why I had to end the furlough scheme, because while your gelato store owner may have recognized reality, actually there are a lot of business owners, people out there who have not recognized reality. They're sitting around collecting paychecks for jobs which are no longer going to exist. Not only, first of all, that costs the government a lot of money, but even leaving that aside, there's no future. We have to adjust. And because I'm a Thatcherite economist, I'm the Chancellor, I believe...
Yeah, well, how did that work out for you in 2010? Generated the slowest recovery in 350 years.
But my line is, well, obviously you, Danny, and friends aren't spending your money on gelato, but you're still working, you're still earning, and so you're going to be spending your money on something else. And therefore, the market will sort it out. Jobs will be generated in whatever you're spending money on now, Netflix.
Well, I take that. I think there are two parts to it, and I think we have to jump to the US to get some story here. I mean, obviously, I agree in the sense that you're going to have an adjustment. And the argument that these kinds of economists have always made is that you've got to throw out the zombie firms, right? But the argument, you and I made this argument in the past, which is, A, we don't know which ones are zombie firms. And the second, if you kill the zombie firms, you kill lots and lots of non-zombie firms out. And if you're going to have these kinds of adjustments, they're going to take a long time. And if you were in a war, then you would adjust and you'd take the debt on. And it's quite clear that the people who said they cared about the debt don't anymore. And then it was just, I mean, that was just nonsense. But here's I think, a story which we can use from the US. If you look at the horrible data in the US, what you see is that the unemployment rate goes up, employment collapses on every measure apart from one. everything looks horrible. What's the one measure that looks different? And I sent you the spreadsheet, we can look at it. Turns out that wage growth has risen dramatically, right? It was 2%, 2%, 2%, 2.6%. As soon as we get to March, it goes to 8%. And it's 8% and 7% and 6%. What does that tell us? Do we really believe that wage growth in the US is now quadrupled compared to what it was in February? No.
No, of course
The reason this has happened is that the effects of this pandemic are not hitting me and they're not hitting Jonathan. Who they're hitting is the lowest part of the wage distribution. What's happened is that the lowest 20% of the wage distribution has just dropped out. So it's like a cricket team. You say, here, it's David Metcalf's batting average effect. Yeah. You say the average for the team was 25. So if you take out batsmen 11, 10, and 9, wow, the average of the team is 50. But not a single person's average has changed. You've just taken out the people who are no good at batting. So the problem is that the people who are going to be hit the hardest are not Jonathan and Danny. They are the people who are at the low end, and especially those who've been hardest hit by the pandemic. The ones who are least able to work from home, the ones who are least able to protect themselves. And what is this going to do? I mean, the story I've tried to push a lot, and people have tried to take it up a little bit. Think about young people. Think about young people who left school in Hackney and in Tower Hamlets and in Hammersmith and in Huddersfield. Okay, you've got these people who are furloughed and you bring some of them back. But what about the young? I mean, the young are going to be a huge issue. And David Bell and I have been trying to get people to think about a sort of civilian conservation corps. I mean, that was a really big deal in the United States. They took 3 million men. I mean, it was men, but we obviously should be thinking of women as well. But they took in 3 million people, planted trees everywhere. And it was a really positive thing because there is no alternative to let the zombie market fix it and solve it. That's not going to work. And there's a recent study out, which is really interesting, which shows that if you look at one of the big things that happened to the 3 million who went on, because there was an improvement to their diet, they were actually taller. They actually gained in height more than others did. So I think the answer to your question, Jonathan, is that obviously we need to be mindful of the speed of adjustment. You suddenly get this hit or this shock, and the consequences are going to be horrible. But and I'm perfectly entitled to say, I remember, and you and I wrote many things about this. In 2010, they imposed an austerity type program like this, arguing that the private sector would step into the fold, and it didn't. And we know that that was all just nonsense. And it generated the slowest recovery in 300 years. And so we're now, I think, in a position where I still think it's probably optimal on the part of firms, based upon what the Chancellor did, to just fire people.
Right. But I guess where I would differ slightly is that in 2010, the problem was not enough demand, basically. Yes. And the mistake the government made was not simply in increasing demand enough.
Yes, I agree with
that. To ensure that people got jobs. The problem here, well, the initial problem isn't, the problem we're still facing now isn't a problem directly of lack of demand, it's that we're still keeping bits of the economy for health reasons, or people are changing, as you say, even if the government isn't shutting down bits of the economy, people are changing their behavior. You're not going out and eating ice cream in the same way because you don't want to risk your health.
Right.
It seems to me that the government, that needs a bit of a different response. The government has done quite a bit to sustain.
No, I agree with that. I mean, everything you said, I agree with, and I think they did a fantastic job in easing the adjustment. I mean, as economists, we tend to think, how can you forecast things? To forecast anything, you have to have some kind of past history, right? We've got nothing we've ever seen like this. So I completely agree with you that it's different. I mean, in 2010, we had the Great Depression and the 29 crash. We've never seen anything like this. Yeah. So the job of the government is to try and ease the adjustment and understand that this is a once in a lifetime shock, and to deal with the pandemic. People are frightened, and so you've got to try and deal with that. But in a sense, I do think that the danger is that you withdraw this spending, and what you're doing is withdrawing spending. I mean, in the US, the argument of why you want to try and withdraw the payments to workers was because, oh, these workers are lazy and they would go back to jobs if the unemployment benefits were cut. Well, they didn't seem to realize there weren't any jobs to go back to. So I think, I mean, I agree with what you said, but there is, I mean, if you think what the Chancellor just did was to cut government spending this week in a period where we worry about spending.
But I think, I mean, the main purpose of, I think what they're thinking is that, you know, you have to have this adjustment, you have to have this reallocation, and you have to let the market do it. And I guess the question is, and this goes back to your point about the civilian corporation, the Civilian Conservation Corps. Well, actually, if what we're seeing is not just a sort of an imbalance between demand and supply overall, but this big sectoral shift. And as you say, it's young people, it's low wage workers, it's people in particular sectors in hit. Those, if we think that a larger number of those jobs aren't coming back, then it follows logically that if we want full employment, we need to find jobs in other sectors.
We need to find jobs in other sectors. I mean, a chilling number, which I hadn't thought about, I assume it's correct. Joe Biden in the debate, or whatever it was on Tuesday, actually reported a number which is 1 in 1,000 African Americans in the United States have died.
I saw a fact check which said that was correct.
Is that right? And it's approaching 1 in 500. So it in a sense, it is so narrow. It's a narrowly focused shock. I mean, I'm doing fine. Dartmouth said, we're not going to give you a pay raise. Okay. I mean, I can cope, but my consulting income's collapsed. I mean, it has impacted folks. We're not doing conferences. We're not, you know, not doing out public speaking and so on, but we're doing fine. But I do think that the misunderstanding, I mean, in a sense, do you remember the George Osborne line? He gave a speech, and 11 times in the speech he said, we're all in this together. I mean, that was a lie at the time.
Yes.
Complete nonsense. But to argue that we're all in this together is just untrue, because if you think of how the pandemic has hit people, it's disproportionately hit African Americans in the United States. I just think, in a sense, this just doesn't have a sense of kindness to it. It doesn't have a sense of gentleness. I'm going to smash you in the face with the market and say, you better go and bloody adjust, no matter what the consequences are. And I just don't think, I mean, I always think this great line, the role of the government is the strong but gentle father's hand. What Osborne did with the austerity that he had is he made communities vulnerable. He took away in a sense, the Hillary Clinton thing, which is it takes a village. Well, what's happened is that the austerity moves made people and towns vulnerable to an economic shock and to a disease shock. And the health service was not in a position to deal with that. So now what you do is you say, yeah, the market can fix it. Well, good luck with that. That ain't going to work. You and I know it's not going to work.
No. But I guess, again, the difference is that in the 2008-10 and subsequently, the decision to that austerity would hit the poor hardest was a deliberate political decision, because the nature of the particular austerity measures that were introduced in particular benefit cuts did that. Whereas here, it wasn't the government, whatever you think of the current government, wasn't Rishi Sunak.
I agree.
Choice that the pandemic has hit on people from ethnic minorities, people on lower wages, people in particular young people, vulnerable sectors hardest. That's just the nature of this pandemic.
But Jonathan, you were an advisor to the government endlessly, for a long time period.
Yes.
And I agree with everything you've said. So now what comes along is this developing pandemic. We didn't know how it was spreading exactly. We didn't know what was going on. And presumably you as an advisor would say, hey, young folks, this is not what we expected to happen, but this is what's happening, and we have to respond to events. I mean, if you go back, look at what Alistair Darling was saying in 2010. He said, oh, we've got to go and put, and cut spending back and so on. But the likelihood is that you and others like you would advise the government and say, okay, but it hasn't turned out the way that you thought, and now you've got to do a U-turn. And that I think is the advice that you would have been giving and would be giving now, which is that it's developed quite how you thought.
Absolutely. And I think on the whole, the government's response here was pretty good in the first few months. And now, for reasons you've said, risks going well off the rails.
Well, let's go back to another example to fit that. So what we saw in the US was a big, very rapid response, and people were getting $600 a week in federal unemployment insurance assistance over and above what they were getting at state levels. Well, for whatever political reasons, which is sort of shock to me, that you're coming to a presidential election and Senate races, and you would have thought, what would we learn from economics?
Yeah.
Send money in like crazy to the marginal constituencies, pour money in so people feel better. Well, the Republicans decided they didn't want to do that. And so the spending stopped in July. Well, guess what? The economy is slowing. So we've had numbers, just to get in context of what happened in the US. We have unemployment insurance claims. We have 25 million people currently claiming unemployment insurance. We had numbers out yesterday. So just get a sense of where we were. We were getting about 200,000 people a week claiming unemployment insurance in the US in the first 3 months of the year. In March, it went to 6 million. So from 200,000 to 6 million a week. So then it went 6 million for a couple of weeks, and then it started to come down. And it started to come down to about a million. It went from 200,000 to 6.5 million. It went to about 1 million, and then started to drop to about 800,000 by the start of August. And now it's flatlined. It hasn't, the decline stopped. And there's every expectation, the numbers we had out this morning suggest that this is probably the low point because everything lags a bit. So the US economy going into a presidential election is slowing. And there are 25 million people on unemployment insurance. And there are huge lines, as there have been in the UK, at food banks. People are struggling to eat. What political situation is that? And now you have the president and the first lady who've got COVID. Part of their argument was this thing is all over. Well, it ain't over. The economy is slowing. This looks like an evolving disaster, and presumably the appointment of a Supreme Court justice before the election can't happen. She's got to go into quarantine.
But then, so I mean, in the US, what would be the appropriate labor market response? Is it just to go back to something like the $600 a week extra unemployment insurance? Is it, as you were saying before, much more direct job creation schemes and actually the government, and this applies to the UK as well, are we at the point where the government has to start stepping in and creating jobs directly?
Well, all of the above, Jonathan, all of the above, in the sense that, let's look at how America is split now. I have a house in New Hampshire and Vermont. There are 0 cases there. I mean, you want to look at somewhere, look at New Hampshire and Vermont. Quarantine. A tourist can go between New Hampshire, Vermont, and Maine, and that's fine. But nobody else can come. If you come into Vermont, you've got to quarantine for 2 weeks inside the country. Right. So that's worked just fine. There are the top 20 states are all Republican states. Cases rising like crazy. So I think what you're going to have to do, some places are okay, some places aren't. I think you're going to have to do a combination of all of those things. And essentially the story in the United States is you're going to have to help states and locals. I mean, the Fed is probably going to have to start buying state bonds. I mean, the state and local governments are basically bankrupt. They can't afford to do the testing. They can't afford to do all of that. So it's going to be, and they're going to start laying off teachers and police and all sorts of people. So the answer is, I think, again, Jonathan was a smart advisor. You would have been saying, I think a couple of things. You would have said all of the above, but each of these, a national scheme probably won't do it. I mean, Jim Heckman's work has always shown us that. What works in Cleveland and Manhattan and Tower Hamlets are different to what happens in Guildford. So I think the answer is all of the above, but I think any assumption that we can step back it is just craziness. And what's going to happen, I suspect, is that any attempt to step back is going to be a disaster. Think of what happened on the pandemic. Everything's fine. We can open everything up. Oh yeah, that's as smart as nonsense. And so I think that's probably what's going to happen. You're going to have to put as much money in as you can. And I think the right way to think of it is, what did you do in a war? What did you do in a war? Yeah. You'd say, I'm going to have to win the war. You don't run up the white flag. I mean, the Chancellor of the Exchequer ran up the white flag this week. And so then the economy starts to go into lockdown. People are, certainly economic activity as a result of what's happened in the last week or so is going to slow. And the government's job is, when private sector spending collapses, is to step into the hold. I mean, that's what Keynes taught us. And we know from the last recession that that was the right thing to do. I mean, in a sense, go back to what happened. We had this great shock. Central banks, people like me, voted for interest rate cuts in QE. Gordon Brown organized a global fiscal stimulus, and actually the thing came back pretty fast.
Yes.
And then the Austerians came and destroyed it, and they're going to do it again.
So, if we look at, say, unemployment in the UK, we have actually now, as you say, it hasn't really shown up in the data yet. The last figure we had actually, you can see, we do actually have some weekly data.
Yeah, of course. We have it on benefits. I mean, if you look at the vacancy numbers, if you look at claims, benefit claims, look at the numbers under the furlough.
In the weekly labour force survey, unemployment was 4.8% at the end of July, the last week we have data for. We have this huge divergence of views among economists as to where it's going. So, the Bank of England and the Office of Budget Responsibility.
I know, I've seen this.
The two most establishment forecasters, one saying that unemployment will go to 7.5%, the other saying it will go above 10%.
And Andy Haldane coming out with the most ludicrous speech I think I've ever heard by a member of the MPC, saying everything's going to be great. You're all elected. It was completely ridiculous. I think there's a set of questions. So let me just give you an example in the US, how hard this is going to be. We talked a little bit about how hard it is to work out what's going on. The assumption is that this thing is going to move dramatically, but there are issues about how you measure things. I don't want to bore people, but this is something students need to understand. So in the US, what happened in March, and I've sent you some numbers, and I'm happy to try and help you with it, but let's just go with the difficulty of measurement. And again, Jonathan, as an advisor, will be trying really hard to get people to understand this. So what you got was the unemployment rate goes to 14.7%. But here was the problem the Bureau of Labor Statistics had. Well, the first thing is responses to these surveys have collapsed, right? The response rates have gone from 70% to 40% because people aren't responding. Secondly, interviewers aren't out there interviewing people. So it turns out there was a fundamental error in the data. So somebody who was laid off, so they were basically not working absent from work, but not working for other reasons. The BLS instructed the interviewers that those people should be classified as unemployed. Well, it turns out that that didn't happen. The instructions didn't get through, and people classified themselves as employed. Now, this mattered because the unemployment rate should have been 20%, not 15%. Yeah. It literally altered the unemployment rate from 15 to 20. The dilemma the BLS was faced with was this. This is an error. We know it's an error. Should we correct the error? Should we actually say the unemployment rate is 20% or publish 15%? Well, actually, it turns out they published the 15%, told you it had to have 5 added to it, but every other estimate, so think of the estimate of youth unemployment, the participation rate of women, all of those numbers were subject to this bias. And so we get the data. The benefit in the US is I have the micro data and I can work it out. In the UK, we have none of that. So it's going to be very hard to work out actually what's going on. So today the number is still about a 0.5 percentage point below what it actually is. So going into this shock, we've never seen anything like this. And it puts a major responsibility on the parts of these authorities. Do they actually correct things, right? So the ONS is, yeah, we do, but you're all furloughed. We don't count you as, we count you as employed, but you're furloughed, but you don't get into this set of data. So we're in a mess. But as I say, politically, it suited the politicians to say, oh, the unemployment rate is only 15%. And Danny would say, actually, it's 20. And I was right. In a way, they were right too. But you know what I mean? So there's an issue about how we actually measure this thing. And you have to look at weekly measures. You look at, so the Census Bureau has started household pulse surveys. The ONS has started to do things. It looks at all sorts of different, what I call the economics of walking about measures. But I think you're exactly right, that it's really going to be very hard to work out with traditional metrics what's gone on. So, I think it's it's a really big deal. But to actually find that the unemployment rate was really 20 and the official number said 15 is a big deal.
And if you had to guess what the unemployment rate will be in the UK as conventionally measured,
Well, I think, yeah, it's conventionally measured by when? I mean, I think it's very hard.
by Christmas, say.
Like, well, hang on. So, hang on. When you say, you mean the report for Christmas, or by the actual data for Christmas, which won't come until 3 months?
Yeah, I mean, I guess I mean the actual
December.
Yeah, the data for December when we get it.
Okay, that'll be fine. So my guess would be in double digits, clearly in double digits by December.
Okay, so that's very firmly on the OBR's, the Office of Budget Responsibility side, the debate here.
Yeah, I mean, I remember the OBR making forecasts in the past and sets of scenarios, and at the time they started to do them, I would always say their worst case scenario was my best case scenario, which turned out to be about right. But I think everyone's right to say it really does depend. But I think during 2020, we're locked in now. I don't think the outcome much depends. It doesn't. I mean, there's no chance of a vaccination coming. Nothing's going to happen in 2020 to fundamentally change things. And I think in train is a slowing America, is a broadening of the pandemic, and a slowing coming because stimulus in the US stopped in July. And then there's the craziness of an election. Markets are in furore this morning because of obviously what happens with Trump. But I just can't, I think in a way, I was thinking this, Jonathan, the other day, if you were an employer and you saw this going on and you saw what Sunak had done, you might be Machiavellian in the sense that, well, let's just fire people, because if we do that, he's going to have to go and reverse himself. Because as soon as the unemployment numbers start to rise again, he's going to have to go and do something. Yeah. So I think that's probable. I mean, if you're an employer and you're struggling, how are you going to survive? You're going to survive by just firing people. I think that's what's coming. They're just going to fire people.
Well, that's pretty grim, and in the US as well.
And in the US as well, and that's obviously coming. I mean, it's coming in. I mean, as I say, we're seeing things now in rural America, which is really very scary. I mean, so there's a really good study perhaps the students would like to see. A new paper out from the IZA about, think of the effects on the economy of this. It was the Sturgis motorcycle rally occurred in South Dakota. It's a great study for the students to read. Yeah. And I wrote about it because I was driving along in the car and I heard the governor talk about this. So she said, the governor of South Dakota said, it's fine, you can have this rally. 500,000 people showed up in July. So these people did this study where they got and looked at telephone pings. So they found a ping of your telephone in the town. Yeah. And then like 2 weeks later, they looked and said, well, where are these people? And they estimated that the rally generated 250,000 additional COVID cases. 250,000. South Dakota and the North Dakota are the highest states now for deaths and cases. And the governor said, this is fiction. Okay, but presumably these are having effects. I mean, the thing that they were tracking was counties where the people went back to disproportionately had COVID. Well, now what we should be doing is saying, well, what effect did that have on their economies, right? And so we have to kind of deal with that. And negative shocks to output. People can't go to work; they're sick. People around them having to quarantine. And the government's job is to lessen the pandemic shock, not to worsen it.
So, of course, here in the UK, we had Eat Out to Help Out.
I know! Eat Out to Help Out.
The government subsidised people to go out to restaurants. We haven't really, I mean, we've had a bunch of people throwing assertions around about whether it was or wasn't responsible for an increase in cases, although we don't really have any proper econometric evidence, I'd say, one way or the other.
Well, no, but I think, mindful of what happened in the United States today, people sat on a helicopter and in a room, and even with all the testing that's gone on in the White House, we now have the greatest catastrophe going. And I've been listening to the TV this morning about, well, what happens if Pence he even tested negative this morning, and then will Nancy Pelosi is the next in line, but actually Mnuchin went to see Trump yesterday, and so this is having, I mean, you can imagine what the markets are thinking and what the uncertainty is about governmental response and, you know, the nuclear football and all of this. But this is a time when the government's job is to smooth things and to reassure people, not by pulling the rug from under their feet, which is what Sunak did this week.
I guess I thought one thing that was very interesting is what you said before about the happiness and well-being data.
Yes.
I mean, as you say, and I've looked at that data as well. And here, of course, you have to be fair to the UK and the Office of National Statistics.
Absolutely, absolutely.
Producing weekly data on happiness and well-being at this point is pretty impressive.
Absolutely, and well, there is a question. I mean, so Daisy Fancourt and Andrew Steptoe at the University College London have been doing the same things. Their data looks to be worse. So their data suggests a bigger drop. But let's just go with this, which I think is interesting. That in a way, if you look back in the UK, the 2008-9 recession was a non-happiness reducing recession. Happiness actually didn't drop. So that's kind of interesting. So now we have, just so everyone gets it, this series that the ONS produced had an average of about 7.2 for a 3-year period. Then it's dropped. We're down in, you know, let's argue maybe it's 6.2 or something. We have never seen anything like that. We've never seen a drop in happiness. How is that going to impact? So think of loneliness, despair, unhappiness. We've never seen this drop. There has been some adjustment to it, but with people's drop in happiness, what does this mean? And I don't know. I mean, it's great that you say we don't have great evidence for the US for it, but you might imagine this is going to shake people to their core. For example, if you were suddenly made so unhappy and so scared, supposing, I mean, again, Jonathan's in his advisory position. I come in and I say, Jonathan, I think what this has done is it's shaken people to their core. And now what we're going to see, unlike in the past, here's a hypothesis, that people are going to start precautionary saving like no tomorrow, because they're going to build themselves a buffer. And if that happens, what's the consequence? And we know the consequence, which is that GDP drops because spending falls, right? I mean, you and I assume you would agree that over the period since 2010, we've been shocked that spending maintained itself.
Yeah.
Right. Spending maintained itself. People build up debt. But supposing the consequence is that people are so frightened, so upset, seeing their parents and others die, worried about, you know, could they pay for a period when there's a shock? Supposing that's the fundamental change, then Sunak's measures look disastrous. You agree with that? I mean,
I do agree with that. Although I don't know what the empirical connection is between happiness and well-being on the one hand and spending on the other.
No, I agree, but nobody knows, right?
I was more thinking about it just in terms of what it actually means for people, because I mean, these are really, as you say, absolutely huge drops. I mean, the dropping from 1 point from 7 to 6 on the happiness scale is what? It's the equivalent of losing your job, or
no. It's about 3 times bigger than that. It's much
or having your marriage break up.
Yeah, no. I've written a lot about this. It's much bigger. It's something like the combination of getting cancer, losing your spouse, and losing your job in the same day.
So that's a really, really big deal in the sense that you talk about, you know, the entire country assuming being hit on average by a shock to their well-being that's comparable to a really bad.
Absolutely. But Jonathan, go back. I agree with everything you said. I mean, I don't know what the consequences of that are, right? But you then have to, because we don't have anything, we've never seen anything like this. But you have to speculate what might happen. And the question is, I mean, think of those who say there's going to be a V-shaped recovery, like Haldane. They assume that has no effect. Everything's just going to V-shape back to where it was. Everybody will be back where they were next year and all is good. Well, if you were an advisor to the government, wouldn't you say, well, that's one possibility. But there's a number of other possibilities, which are that people are scared senseless and they change their behavior. And if they start to change their behavior, which we might well see coming, I mean, we don't really know, but the job of the government is to prepare for such possibilities, right? If you're at war, you prepare for possible attacks. And
I guess, in some ways, I'd be more worried about the potential political and social consequences of
Yeah,
such a huge
yeah,
drop in well-being,
yeah, absolutely.
more than the economic consequences.
No, I agree. I agree with that completely. And again, go back to the young. What are the consequences for the young?
Yeah.
I mean, you might argue in the US, it's not, in a sense, what we've seen is a huge rise in youth unemployment rates, particularly amongst minorities. Well, what do young people in urban areas in the summer who are unemployed do? Well, we've seen unrest in the cities,
Yeah.
social unrest.
Do we, I mean, do we know, you know, you've looked at I've just looked at the headline data, but maybe you've looked at some of the more micro data. Do we know who is being hit by this, you know, who is suffering, or is everybody just unhappy?
Who is suffering from the unhappiness drop?
Yes, I mean, we know, as you say, we know in income terms that people like you and me are basically fine, whereas young people or people who work in particular sectors have been very badly hit. But do we, you know, for happiness and well-being, is it actually that everybody is pretty, you know, because it's a national catastrophe?
Well, the answer in a way is not exactly that. The way that I've been writing about it and thinking about it is, and Case and Deaton especially been thinking about it, it turns out the ones in many senses who are the most vulnerable are the prime age. So an example is, so who's most like, I mean, we can talk about this in the US especially, who's most likely, who's most vulnerable to potential suicide, drug poisoning, alcohol poisoning?
Right.
Turns out deaths of despair are disproportionate amongst prime age, less educated folk. It's not actually, I mean, so there's that. And you can obviously work on the vulnerability to the pandemic, and that has to do with pre-existing conditions, being old, that stuff. But that's not uncorrelated with being prime age, less educated, in despair with mental. So I think in a sense that there were two things you could do, and it was clear people started to do it in the US. Which states and cities were most vulnerable because of people's health, but then which groups are the most vulnerable? And I've got a new paper came out last week in the American Journal of Public Health where we look at the proportion of people who report being in despair prior to the shock. And I measure despair as being this. Ask people, how many of the last 30 days were bad mental health days? Most people say 0, but actually a chunk of people say all 30 of the last 30 days are bad mental health days. In America, that's doubled in 25 years. And just to put it in context, if you look at prime age, so between 35 and 54, white, less educated, men and women, 1 in 8 say that. That was before the shock. So I think you have to look at the people who are most in despair, most unable to deal with that shock, people who are unhealthy, who are most unable to deal with it. And then the other one is, let's look at communities that the austerity has made most vulnerable, the ones without social backup, the ones with inadequate testing places. I mean, in a way, if you had strong social framework, this issue of testing will be much less true because you've got places that would have prepared for it and so on. So in a sense, the Johnson government is in a pickle because Osborne put it in a pickle by taking away the infrastructure that would have prepared that. So it's a vulnerability of communities, of unhealthy people, but then of people with poor mental health. And Richard Layard and others have been emphasizing for so long the importance of better mental health. So I think those are the groups who look most vulnerable. And shocking to everybody, suicide rates peak in midlife.
We haven't, I mean, we don't really have any data yet on suicides or mental health.
Well, we do have some data on it. I mean, there's things like, I mean, again, economics are walking about calls to helplines, you know, calls to suicide lines, all of that sort of stuff. I mean, I think the other one is obviously calls to food banks. It's not surprising, right? If you can't get, I mean, in America, you've got these huge lines of people. So in the data, we do have big rise in the proportion of people. I mean, the US, the Census Bureau Household Pulse Survey has proportions of people who feel lonely, anxious, and depressed. That number's rocketed, especially for the less educated. So again, there is some evidence of it. I mean, obviously there's stuff you and others have talked about, which is, you know, okay, so the hospitals are not, people have been wary of going to the hospital. And so what about people who die at home because they shouldn't, all that stuff. and we don't really know Chris Giles has been doing lots of stuff on it, but we don't really know the answer, but the answer doesn't look to be good.
I mean, I guess one question I have is whether this fall in well-being has been driven by, economics, i.e. the people who are unhappy are people who've lost their job or seen their income go down, which of course we know is bad, but actually generally not as bad as the data suggests.
Yes.
Whether it's the other consequentials of the pandemic, not the directly economic ones, the social consequences, not being able to see your parent, not being able to see your family, not being able to go out and socialize in the way you normally do, which of course affects to some extent, or I mean, it obviously still has differential effects because people have different support networks, but it's not on the same dimensions as the economic impact.
No, I agree with that. I mean, in a sense, the Fancourt step-toe work does show that people have become adapted to it, right? Yeah. So despite the big drop, there's been a pickup, even when we get to 6, came up from 5. So people become adapted to it. But I think we know, I mean, I don't exactly know the answer, we're trying to work on it. People compare themselves to others. So when everybody's in a mess, everyone goes, okay, we're all in a mess. The question then is, am I more in a mess than you are? How come you're doing fine and I'm not? So I think the answer to this is relative things matter. And the question is, who do people compare themselves to? And this is going to matter here. I mean, think of the 50 Labour constituencies that voted for Johnson. Suddenly we're seeing a move in the Labour polls. What about those places? How have they compared themselves to others and said, well, there's nothing here for us. We need some help. What's going on in those places that essentially Johnson got elected from? I mean, with the expectation that they were going to kind of do better. So I think the answer is, if you start to see more evidence that, London's doing fine and, Bolsover and Darlington are not, I think that starts to become a big issue. And in a sense, it's back to what you and I were saying, that if you're going to do help and assistance and aid, what you do in Guildford isn't the same as you do in Bolsover, because the social kind of backdrop is so different. I mean, think to the old coal towns, think of the Rhondda Valley, think of Sheffield, where the places where the manufacturing has gone. What's the resiliency of that community? And you've probably got to, I mean, the Conservation Corps went to a particular place, didn't go everywhere. It went to, and so you might think of the climate change thing. You could do things in this Conservation Corps across the spectrum of the education. I mean, people coming out of college who can't get work, you could see high-tech stuff could be done, but planting trees might not be a crazy thing to do. The danger is that you do nothing. But I just keep trying to emphasize, I think relative things matter, and what you have to do in one place will be different to what you do in another. And I presume that that's the kind of advice. But what we've seen over the last decade is that you had central banks driving things, so regional policy mattered less, and the ability to kind of, an interest rates are the same in one county compared to another. And the government has sort of said, I don't care about regional things. Well, they better bloody start worrying.
And so, I mean, let's see, we're getting near the end, I think, of what Zoom lets me do.
Yeah, that's fine. It's interesting. I mean, you've been good on this as well. I mean, in a sense, I think I'd like to hear what you think. I mean, in a sense, what you want here are smart people trying to think about things that have become, which were unthinkable. And so we're in a position where we just don't really know. Think about in the last 3 or 4 or 5 months, what central banks have started to do. I mean, they've been starting to think about negative rates and buying all sorts of unthinkable things. I mean, it could well be, I mean, in the United States, the whole idea of negative rates, and in America, the central bank really could only buy federally insured things. The likelihood down the road, they'll buy almost anything, and partly because they need authority from the central government and from the Congress. They're going to give it in a heartbeat. So we're in a world of unthinkable things. And if you say the central bank does that, what are the consequences? What is it? Don't know. So you need smart people. And what's interesting for the Michael Goves of this world is actually what you need are experts who can think things through, think out all sorts of scenarios, because the idiots who say you didn't need experts are now just looking like idiots.
So if I ask you to say, well, what will be different in 5 or 10 years as a consequence of all this? Where will we be? What would you say? You can give an optimistic or a pessimistic.
I'm gonna give a bit of both. I mean, I think Jonathan, you presumably been in the situation where people say to you things like, "Where are all the new jobs going to come from
Yes.
in 20 years' time?" And your answer is, "I don't bloody know."
Exactly.
Right? I mean, imagine if you sat in the year 1980 and you look today, and would you have been able to predict where we were going? No.
No.
So I think what we're going to see is a much greater adjustment than people have ever seen before. People are going to have to adjust their behavior permanently. Maybe permanently they're going to stay at home. Maybe permanently this has an impact on the city. I mean, people, so where I live in the States, there's a place where I have a golf course and people come to there in the summer. So people from New York come to this place in New Hampshire to their summer houses. Well, actually, they left New York in March and they moved to their summer houses. They've given up their places in New York.
Yeah.
New York rents in New York are collapsing, but so there's changes of that kind. People are going to prepare themselves, presumably, for the possibility of other pandemics coming, but also for fundamental failure of governments. I mean, in the United States, you ought to prepare yourself for saying, "I don't believe a word the government says."
Yeah.
So and then you have to insulate yourself. So we're going to see adjustments. Some people are going to do fine out of this. You know, Amazon and Walmart have done extremely well. And the shops around me here, you can order everything online. They're swamped with people. You can just go to the thing, order your food, and it shows up. And people would like some of that stuff. So I think we're going to see many more people working remotely. We're going to see them changing their behavior. I mean, I go to Amazon, buy all sorts of stuff. You know, order Marmite. You can order Marmite on Amazon that comes in two. My son lives close to an Amazon place, and he orders sandwiches. They come on a drone in like 45 minutes. So that world is a new world. The other thing I think is we're going to value healthcare more. We're going to value basic workers more. So healthcare workers, delivery people who are just fundamental to our society. You know, our views about minimum wages and you know, basic incomes are going to change. But the idea that government is bad, I think, is the fundamental thing that actually is going to be rethought, because in a health crisis, that's what you need. And the one thing I really think is interesting, which may change it, I'm a big fan of John M. Barry and his book, The Great Influenza. He says, when this all started, he said the one thing that you learned from everything happened in the Great Influenza is that the authorities should tell the truth.
Right.
And in fact, you probably might learn this today, that actually what's happened is that Trump and his people have not told the truth, tried to cover up that things can be spread from children, tried to say this thing is over. And it's had very big consequences. So I think people are going to say, it's not just what's the role of government, it's that government's got to tell the truth. And I think that might I mean, if you conclude from this, what should you conclude? You certainly should have concluded you should have worn masks. You should have done all the social distancing, and you shouldn't listen to a word that the American president said. And the whole campaign, this is all over. So I think the answer is go back to John M. Barry. Government people are not gonna trust it, but they're gonna realize the importance of telling the truth. And America, I mean, the evidence is that many people have died in America because this government didn't tell the truth.
Well, that's a cheerful note to it. Well, I mean, there is some optimism there, because some of what you said, you know, that there will be new jobs. We will give greater priority to healthcare. We will be able to do things which we didn't think were possible a few years ago, now are possible, and will hopefully make life better. So there is some positivity there.
I like in a sense, what you sort of developed during our discussion was we talked about the shock, right? And what Sunak did, and he's going to say the zombie. I mean, that was all stupid, but that's not to say what we've ended up talking about is there are going to be changes. There's a shock. It's like somebody got injured, right? I broke my ankle. What happens is you break your ankle. Oh, you can't walk. You're in bed. It's in pain. Okay, but then you have to go into rehab, and rehab takes a while. So the economy gets hit by this shock. Should you suddenly say, right, start walking again on your broken ankle? No, but you say we're going to go into rehab, we're going to go to physical therapy things, and we're going to adjust. And it turns out what happens, we know when people get injured, it turns out life often is not quite as bad as, this is an analogy. So you say to people, well, so you're a football player. What happens if you have an ACL injury and you never play football again? And they say, oh, it would be terrible. Well, it turns out there's actually things they can do. And it turns out that they adapt, and they find that they like to go golfing or they go fishing or whatever. And the world is a world of adaptation. So I'm positive on the adaptation thing, but I just think the government, certainly the Sunak thing this week, sort of, and the silliness of Haldane's thing saying chicken licking, that's silly. I mean, it's gonna take a while. You don't want to have a broken leg. It's not going to be all right in a year's time, but it might well be different and better.
Different and better in 5 years.
Better. I wanted to end on that positive note. Different and better, where people in crap jobs aren't in such crap jobs. They're not paid £8 an hour. They're paid £20, £20 an hour. They're paid better things. Their healthcare is better. Their lifestyle is better. And maybe they have to wear masks if they got a cold. Maybe they're gonna be more cautious about certain things. Okay, that's fine. But that might end up raising happiness. So I think you make people more resilient and you prepare them and you don't lie to them. And what's happened is lying to them has cost lives, which is what John Barry said happened. I mean that if you looked at the Great Influenza, you can look exactly at what happened in the US. That states and cities that said this is a really bad pandemic, you've got to socially isolate, wear masks, all that stuff, they did fine. And the ones who said, like Trump, all is fine, don't worry about it, don't wear your mask and, you know, sit. I mean, what happened on Tuesday was the Trump family came into the Cleveland clinic, were told to keep their masks on, walked in, took their masks off, were told by the doctors and the people there, please put your masks on. They wouldn't do it. So now the president, and they're all in quarantine. Well, the public probably noticed this. Yeah. And they ought to realize that, you know, stupid is as stupid does. The quote. So I'm kind of optimistic through all of this, but for goodness sake, strong but gentle father's hand.
Well,